We in the Gold Coast are launching what I believe to be the biggest and the best resourced endometriosis centre in Queensland, based at Varsity Lakes Hospital. We have created an absolutely perfect multidisciplinary team that treats all aspects of endometriosis.
We have got the gynecology team, but we also have dietitian, physio, psychology, nursing staff, pharmacy and social work. Also colorectal when we need to reach out to them.
As a physiotherapist, we're looking at how the muscles might be a contributing factor.
A big part of the role for psychology is to really provide the emotional safety.
All patients need something slightly different, so with a multidisciplinary team we can offer individualised care.
We really want to know their story. We want to know the intricacies, the experiences and the impact that it has had, and we believe every feeling and sensation that you have ever experienced is real and it does matter.
Persistent pelvic pain and endometriosis is difficult because it's not something that you can see from the outside. It's something patients will often suffer with in silence, with an overlying cultural understanding that period pain is normal. And so women will often suffer with persistent pelvic pain for years before they seek help.
Endometriosis seems to affect more women in Queensland than it does in any other state.
Most individuals that come into our clinic, if not all of them, have been on a really tough journey to this point.
There is much more to endometriosis than surgery.
Because it is a complex condition, we know that it can involve not just your uterus and your ovaries, but also your bowels, your bladder, your muscles, and also the other parts that come with that: mood disorders, sleep disorders, changes in your quality of life.
Women have come in, they've had surgery, but then they're cast adrift. And in that post-surgery era, they're still symptomatic because the rest of their concerns have not been addressed.
Once the patients have finished their time with us, with our service, we will create a very detailed handover document to the primary care provider, so the GP, so that management can be continued in the community so that we do have those long-lasting effects that we're after.
As this is a public service, there is no fee associated with attending this clinic.
I hope that this is a door that they can come through where they have a very different experience.
It's not in their head. There is a scientific, physiological explanation for why they're experiencing the symptoms that they're experiencing.
I think that this clinic will be an absolute game changer for women and will improve women's quality of life no end.